eyebrow division. At Anagen Hair Transplant, we have a very specialized eyebrow hair transplant division headed by one of our plastic surgeons. Now, let me tell you why you cannot do eyebrow hair transplant in any clinic except the premium and the best, who has been doing hundreds and thousands of eyebrow transplant. Why? See, these hairs are pretty different, very difficult to find. Maybe somewhere in the body or nape of the neck or near this. The texture has to match. Because if the texture doesn't match, it will look very bad. Number one. Number two, these hairs, when you put it here, they grow very fast, and eyebrow hairs don't grow very fast. That's why for a women or anybody, if they have a straight hair anywhere in the body, it's preferred because they won't grow as fast. If not, then of course we have to use nape of the neck hair because these hairs do not grow too fast. Point number three. See, this direction of the eyebrow hairs are straight, then they turn, then they turn, then they turn this side. And then there is a crisscrossing. Then there is a crisscrossing also. So the directions of the hair follicles quite changing. This is 5 degree, 5 degree. You cannot make it this. It's 5 degree. Most important part, the curl has to be this. The curl has to be this. The curl has to be this. Imagine if they grow like this, if they grow like this, what? So very critical. Then the hair, so what we have to do is take the right hair. Then there's a tissue around the hair. We have to remove it. We have to trim it. It should be very slender and naked. Then otherwise at the base you will see raised structure called cobblestoning. We should not go too down. Then you see pitting over here. Okay, so you cannot keep removing those hairs if they are wrong always, right? So the direction, the curls, the angles has to be very flat and they have to be perfectly aligned. So it's a very specialized job. It takes 1 full day just to put some grafts. Okay, it takes a big team to do every step separately. First, a designer comes as per your face shape, age, skin type. He or she designs your eyebrow. So they give us the complete blueprint with beautiful design. We show it to you. You are acceptable. Before that, we go to the net and search different designs as per your ethnicity or as per your face shape. Now the designer creates a design and a boundary for us. Then the surgeon make the correct slits as per the blueprint given. So the angle, the direction, the curve, and trimming of the grafts is very critical. The device used to make slits is very critical. Handling of the grafts is critical. We cannot afford to damage the stem cells. We cannot let the graft dry. So they are very fine hairs in a perfect fashion they have to done. Somebody has to take close dermoscopy, zoomed view every time. So they keep checking, are the hairs going in the perfect direction, perfect angle, everything is perfect or not. So in between somebody comes, do the dermoscopy, take the zoomed and large view and show it to the doctors. So every hair has to be followed. 2, 3, 5, 7 hairs go haywire, they have to be removed and reimplanted. Okay, not just now during the surgery, but we call you after 3, 4 days for eyebrow wash. Again, if we see little direction, little angle, something is wrong, we remove it after 3, 4 days and again put it there. So it's very important, the curl, the directions and all. So now normally what we have seen is in 99% clinic except the top one, too much tissue is there. It's bad because there will be cobblestoning. The texture is not the same. So just putting hairs, it looks more bad than not doing the eyebrow hair transplant. Then better you do microblading. We have a microblading section also. Sometimes we do combination of microblading and eyebrow hair transplant. And sometimes we do either separately. So watch this video to see some of our work about eyebrow hair transplant.